I did it all. Drink alcohol, smoke marijuana, crack cocaine.
I was addicted to perks and hydros first, and then I moved on to the harder stuff.
America has a drug problem. Substance use disorder is common. It's in our big cities, but it's in our small towns too. It affects people in all walks of life, including America's veterans.
I total lost a brand new car, a truck that my wife helped me get. I got thrown out of the house a couple of times.
I've lost a lot of friends. I lost where I was living at. I've lost my license. I almost lost my daughter. Almost lost my life.
We know how to treat substance use disorders, but providing access to care can be tricky, especially in rural areas, places like Rutherford County, North Carolina.
Our primary hospital is in Asheville, and that can be, for some of our veterans in some of the surrounding areas, it can be 2 hours away. Asheville is up kind of a mountain. It's a steep grade. And like I said, a lot of our veterans, they just cannot drive that. They cannot travel that distance, and they can't navigate that grade.
Well, they say going up the mountain on 40, that's a little treacherous, especially if it's raining or snowing, if it's dark.
I think if we didn't have the outpatient clinics, they would not be seen. They would not have access to care. They would be missing a lot of their primary care.
We have plenty of veterans. We need practitioners that are able to come here and see them. And there's a limit to the number of, say, physicians you can get to come to a rural clinic. So they're pretty dependent on what I call physician extenders.
Healthcare facilities have been using physician extenders, such as physician assistants and nurse practitioners, for some time.
Hey, Dr. Gibbs, come on in.
In the VA, there's another group of physician extenders, clinical pharmacist practitioners. Two of them work at the CBOC in Rutherford County.
Clinical pharmacist practitioner is a pharmacist provider who provides direct patient care and comprehensive medication management to patients within the primary care clinic.
We cannot diagnose patients, but as long as that diagnosis has been made by someone who's able to diagnose, then we can provide all of the care.
The primary care providers have so much on their plate. They're, managing many disease states, very immediate, urgent issues. And I think the primary care providers appreciate that as CPPs, we're able to take care of the veterans' chronic disease states, and so they don't have to worry as much about the lower complexity conditions, and they can focus on the more acute conditions.
Most health problems require medications as part of their treatment. CPPs have particular expertise in managing medications. They have the authority to start, stop, or change prescriptions within their practice areas.
Clinical pharmacist specialist wouldn't be, say, handling a primary care panel, but they would be handling a component of that panel, either statin treatment, diabetic treatment, or substance abuse treatment.
And he's already on gabapentin max dose.
Okay.
We work collaboratively as a team where I can help them with the medication side of things. They can help with the diagnosis and a lot of the other collateral parts of a disease state that maybe I don't know as much
I
about.
wonder if we could use a tricyclic antidepressant. Maybe add that on. Maybe we can switch him.
They are the experts on medication, without a doubt, hands down. So, hypertension, heart disease, diabetes, chronic pain, opioid use disorders, we can tap into their knowledge.
I'm in the clinic and my primary care provider messages me that a patient needs something. I can just walk across the hall and, go into the room and talk with the patient. I'm very accessible, and patients are able to come see me, whenever they need me, really.
If the patient is here and has a need, what better way to meet it than to do it right at that time? And so being physically located here it's always the best option.
We appreciate you guys, everything you guys do.
Treating substance use disorder in primary care is uncommon, especially in rural areas. But the Rutherford County CBOC saw a need and they use their CPPs to meet it.
Yeah, I think that starting an initial program like that at the Rutherford C-Block would be a good idea.
The reason we started is because the programs that are available are very scattered. They're not readily accessible. So what we were seeing is a lot of our veterans that have substance use disorder were lacking care. So if we didn't provide this option to them, if we didn't work with them and work with our pharmacists, I think they would be back using opioids without a doubt.
Hi, Tim. How are you doing?
Dr. Harris talks about her patient, Tim.
How have you been? When I first met with this patient, I realized there was more going on than just uncontrolled hypertension and gout. When I started asking him questions about his alcohol use, I realized that that was partly the reason that he was having pretty significant gout. We also talked about blood pressure, and the reason for the high blood pressure was mainly due to cocaine use. And he was using the cocaine to really cope with the gout pain, and the gout pain was coming from the alcohol, so it was just a dominoes effect.
When they gave me the blood test and told me that they know that I was using cocaine, that's when I realized it's no use to lie no more. That made me want to just, get my life together, and for the sake of my grandkids.
Some clinical pharmacist practitioners are authorized to prescribe controlled substances, such as buprenorphine.
Buprenorphine is the drug of choice for opioid use disorder or opioid dependence. The DEA license allows me as a pharmacist to actually prescribe that controlled substance without someone else having to sign that order.
Dr. Gibbs talks about his patient, Andrew.
Andrew was one of our early patients here at the clinic. Andrew had used substances with multiple friends for years, was headed down a very dark road.
There's probably about seven or eight of us that were all doing the drugs at the same time, yeah. There's only 3 of us left. They've all died from overdose.
Andrew was ready to make a change. He was started on buprenorphine in the hospital and then followed up with me here in the clinic after that.
It was probably 2-3 times a month. He would check on me, make sure that I was taking my medication right, seeing if I absolutely needed anything. He gave me his cell phone number right away, told me to call him or message him whenever I needed anything. And it's great to know that I can reach out to him with any questions I have.
Incorporating CPPs into the daily practice of medicine has made a huge difference at the CBOC in Rutherford County, and an enormous difference to the veterans it serves.
There's a shortage of physicians that want to be in rural areas. It's not even practical to think that clinics could be completely manned by physicians at this point in time. And the way to survive is to supplement the care with other specialists.
I would recommend that clinical pharmacy specialists are at every CBOC. I can't imagine the clinic not having them available to collaborate the care, to talk with about polypharmacy, to look for different medication options. So yeah, I think it would benefit any outpatient clinic, absolutely.
And your kit will come with 2 of these,
Okay.
just like this, okay?
Be able to try to help you out on everything. Pains, addiction, and everything that's going on in your life that you think that you might want to give up. The VA has got your back. If it wasn't for them, I don't know where I would be.
It makes me feel really good that he's able to, live a happy life and spend time with his family and have that support because I was there for him.
My family stayed with me. The doctors stayed with me. This would be a big role model to my grandkids instead of being an alcoholic somewhere on the street. So I'm just proud of myself.
I would say Dr. Gibbs saved my life, 100%.
He's productive, he's successful. He's stayed in recovery for well over a year, and that's so exciting to be a small part of.
I feel like I'll stay clean this time now that I have him in my corner, Dr. Gibbs in my corner, and I think I can do it.
And now he is reunited with his daughter. He has 50% custody of her, and they have a wonderful relationship together.
I needed to have my daughter back. It's all I care about. She's my everything. She makes me feel young. She's my world.